Westchester County, it sits just north of New York City, and it could be considered a microcosm for the fight against coronavirus. It was one of the first areas in America to have a major cluster when an outbreak occurred in the city of New Rochelle back in early March. Officials, they moved quickly and they formed a containment zone around the area, and since then the curve has appeared to flatten. Also, Westchester will be just like hundreds of other counties in America, strapped for cash and forced to balance its budget, hoping the federal government will provide a lot of much needed financial relief. I want to bring in the man who runs that county, Westchester exec George Latimer. George, I'll get to the math in a second, but let's talk about the health of the county. Specifically, we're going to be talking with the nursing home directors for the state of New York. How concerned are you that the nursing homes, first and foremost, have their act together in terms of a reporting standpoint so you know the situation that you're dealing with on the ground?
Well, Richard, we're very concerned. I think it's pretty clear that nursing homes are an area where you've concentrated the people who are most vulnerable to this disease, and that we've seen, whether it began in Kirkland, Washington, or some of the experiences of what we're hearing here in New York, that we're dealing with the spread of the virus amongst people who are the least healthy and the most likely to die from this. And we've had a significant number of fatalities in those nursing homes. The state of New York, Department of Health, regulates the nursing homes. The county government, the local governments do not. But what we've asked for is an ongoing review, not just to go in and take a look once and leave, but an ongoing review of what's happening in each of these different nursing homes. Because while it may not be our responsibility or authority to act, we certainly have to deal with the end product of it. And if we have a very high number of fatalities, that process falls on the lap of the county, as well as local businesses, the funeral directors, the cemeteries. It's a terrible bit of business, and we need to have a good handle on what's happening there.
For folks who don't know, the county of Westchester has about 1 million people, bigger than some states' populations. We've seen played out, we talked about it earlier this hour, where you're seeing protests, where everybody understandably wants to get back to some kind of normalcy. I know you're not dealing with that, thankfully, but talk about that balance and when you'll know, and I know it's going to come from Albany, but still, when you'll know is the right time, because some cities still are dealing more acutely than others in the northern part of the county. How do you navigate and give counsel as to when you think your county is ready to basically open its doors?
You know, Richard, it's interesting because there's no roadmap here. None of us have anything to go by of recent vintage that says, you know, when in this situation, this is how it was handled at some point in time in the last 15, 20, 35 years. So we're assessing as we go along. Right now, it's clear to me, and I think to everybody, that we're at we have flattened the curve in Westchester County. Our active number of cases are relatively flat, even though the number of positives increased. The number of people that have gone through 2 weeks and not become ill has reduced it to almost a flat number, around 10,000 cases. Our hospitalization rate has been flat, slightly decreasing, so those are two good signs. But the bottom line is, being flat is not the same as seeing a recession, a loss of the number of active cases. And so we're still testing, and Westchester County has tested more per capita than any jurisdiction in New York State, but we haven't even approached at 70,000 tests, 71,000 tests, the 1 million people who live in the county. So we've got a long way to go, and there may be plenty more people who are out there who are positive and we don't know about it. When we can test a significant percentage of the population, then we know who has to be isolated. If those people are isolated and you open a restaurant, you take your wife or girlfriend or your buddies out for a meal, and you're reasonably confident that the people that are out in public are people that have cleared the disease. You don't know that if everybody hasn't been tested. And then you go to a restaurant, a terrific place that's packed to the gills, and you wonder if you haven't, made yourself vulnerable to the virus. The same would be true about going to a sporting event, a major baseball game, or, if we ever do play the end of the basketball and hockey season. So that's what's going to tell us whether or not we can fully reopen it. I think we can reopen parts of it, right away. Certain things, I think you can deal with religious institutions, and you can social distance and put in certain parameters and reopen some of those doors. But to get to the point where you can walk in a bar and have a couple of beers with a group of people in exactly close quarters, that's not conceivable until we get a better handle on where we are with the disease.
You, governors, you guys got to make your budgets match. It's not like Washington where they get to pass it on to the next year, the next administration, et cetera. The craziest thing that I'm not so sure the general public has put their arms around is if the federal government does not send a package to states that comes down to counties like your own, the idea of those hospitals who have been going 24/7 and the police and the fire going well beyond that and all the frontline people, you're going to have to basically, as I said earlier in this hour, take an axe, not a scalpel, to these budgets and to the schools, for crying out loud. Just talk about, I know you said, forget the rainy day. It's a fiscal monsoon that's hit. Give an idea if you can, because I don't care where people are watching me. It's their reality too. Just how steep and painful some of the cuts might be if Washington doesn't help lessen the pain, because it's still going to be painful.
It's going to be painful no matter what we do. We've identified $21 million of cuts to spending already in the budget to offset what at the low end may be $90 million of lost revenue, but on the outer end can be 160. The reason for that range, Richard, is not knowing when we're going to be back in business, when we can start seeing sales tax revenue and hotel tax revenue, et cetera. We employ police officers that enforce the law. We employ people that manage a county jail. We employ people that treat sewerage and operate complicated sewer treatment plants. We have public health nurses that are out applying the tests. When we have to cut a third of our spending out, if that's what this turns into, we're going to have to go, as you said, with a meat axe through personnel. And this narrative that you hear out there, oh, the bloat of government, and there's a lot of unnecessary things, that's from people that don't really understand. They've never looked at the county or the municipal budget. They operate off of a general sense of things, and maybe they see one guy standing on a corner and they think, oh, they're all lazy. These are essential local services that are provided by public workers, and when you get to the point of saying, good luck, county, good luck, town, good luck, school district, you're on your own, you're going to see the collapse all across the board of services that we've come to accept. This is, if the federal government specifically turns its back on local governments, then people in these communities are going to turn their back on the federal government, because this would be like turning your back in a moment of crisis. During the Depression, during World War II, the Civil War, the federal government says, we're not going to be bothered with that. That's not our problem. It'll be a big problem. And I don't doubt that if we don't get a handle on the unemployment situation and the broken businesses, you could find civil unrest to follow. So it's a foolish path to go down, to not see the federal government as the partner that it needs to be to all these other governments, to individuals, to small businesses and large businesses, to not-for-profits and churches, and to governments as well.
And that in itself is, you said it better than I could have, but we know there's going to be a second spike. We don't know when it'll be, we don't know how steep it'll be, but every pandemic has not stopped after the first hit. We're going to actually have less people on the front lines when that day comes. I mean, it borders on the insane.
Well, unfortunately, we get caught up in political rhetoric. I've run for public office. I'm a member of one of the two major parties. I understand what happens in the normal competition and the scrapping over issues. This is the most important test in my life. I'm 66 years old. This is the most important test that I've seen, not our government, but our society goes through. I heard stories of my parents going through the Depression and World War II era. We're 5 weeks into an economic shutdown, not 3.5 years of sacrifice on behalf of our war effort to defeat the Nazis. 5 weeks. And we have people complaining and saying we need to restart, we need to be able to go out and do what we want to do. This country does not realize what kind of a collapse we'll face if we don't show discipline and stamina in dealing with it. And we'll look back on the collapse of 2020 because of foolish public policy, which we were narrow-minded, if all we think about is what makes it for me through the next election cycle.
Well, County Executive, I wish you the best of luck. I know you're going to need more than just that here in these trying times, but I do appreciate you making a few minutes for us. Thank you.
Thank you, Richard. Always appreciate your work.
All right, everyone, when we come back, one of the subjects we discussed, nursing homes. They are under fire as deaths due to the virus spike in those facilities. After the break, the man who represents nursing homes for New York State, he'll provide us with his take on the crisis.